My name is Raymond Buscemi, and I'm a licensed psychologist. I work in San Francisco. I am a client of Healthy San Francisco, and I feel fortunate to have that coverage. I used to work at a research institute where I had benefits, and as the money kind of dried up for the research, I decided to go into my full-time private practice.
My name is Brian Favorite, and I'm a teacher, a videographer, a documentarian, and a student. I signed up for the Healthy SF program because of my financial situation. I am a student and part-time worker, so I do not have benefits with my job. So my roommate had told me about Healthy SF, and I'd also heard it from other people, other friends. And so I did a little research about it and was able to find out that I could be eligible. So I looked deeper into it and found out that I was.
I think Healthy San Francisco is one of the most innovative programs in San Francisco. I am a 25-year resident, and so I've seen attempts over time to really provide care for the indigent, for the poor, for people who are working but can't afford insurance or aren't covered.
The process to sign up for Healthy SF I thought was pretty easy. I had called the organization and they had told me what paperwork to bring, which was tax forms from last year, pay stubs from the jobs that I have, and proof of residency of San Francisco. And so when I went in, waited about an hour and was called and had a specific counselor meet with me, who was very helpful and very diligent in her job and was able to sign me up on the spot.
I mean, for clients, we're talking about people of all walks of life. Poor people, homeless people, Medi-Cal recipients, working mothers, working fathers. They haven't had access to physical exams, to mammograms. Access to healthcare has really been one of the obstacles to good health and wellness. So Healthy San Francisco is really looking for a way to get people out of the emergency room, out of the urgent care clinics, and into more preventative medicine models.
If Healthy SF was not going to continue, I guess because of financial reasons or other reasons, I would think it would be probably a very large letdown to many people, I'm sure, in the city.
If for some reason Healthy San Francisco couldn't continue, I think it would be disastrous for the city. Because we're talking about populations in San Francisco that have never experienced sustained health coverage. So for them to actually have the risk of losing that coverage means that they actually are at risk of losing some of what's keeping them going. It's also about knowing that you're cared for by the people of San Francisco. That actually is, I think, the message at the heart of Healthy San Francisco. It's San Franciscans telling each other, we care about you and we want you to be okay.